Hey guys, Dr. Lee here. So we just finished doing an awesome workshop in our office on heart disease prevention called Heart Strong. What I'm going to do on this recap video is go over the finer points of the workshop, why it's so important to keep a healthy heart, and the action steps you need to be taking to work on preventing heart disease, or if you have heart disease, to start working on reversing it. It's so important to understand the underlying cause of heart disease, because when you have high blood pressure or when you have cholesterol issues, the common solution in our day and age is to take a medication for those. I have patients that are commonly prescribed those medications, and what newer literature is showing is that those medications may not be effective in actually preventing you from dying. They may temporarily lower your blood pressure, they may alter your cholesterol levels, but they don't fix the underlying cause of the issue. And when you don't fix the underlying cause of the problem, your body never gets better. So we're going to talk about underlying risk factors and how to work on getting a healthy heart naturally. So what are the actual risk factors for developing heart disease? Number one is stress. Stress drastically increases your risk of heart disease and early death. Whenever we stress, it raises our body's cortisol levels. Cortisol is a hormone that's released in response to stress, and that's what causes blood pressure to accelerate. It's what also lowers our body's immune system when we have long-term sources of stress that we can't avoid. Stress was meant to be a good thing. If you're, in a fight for your life, if you're running from a bear, you need that additional stress to increase your blood pressure, to push all the blood into your muscles so you can either fight the bear or run from the bear. The problem that we have in today's day and age is we are stressed with things that we can't get rid of. We're stressing about emotional issues, mental issues, exams, tests, presentations, life in general, and that chronic stress really wears on our body. Number two is having a poor diet. We know that a poor diet creates something in the body called inflammation, and inflammation affects everything. It increases our risk for type 2 diabetes, for heart disease. It elevates our body's poor cholesterol. It causes claudication and hardening of the arteries. Every pound of excess fat that we have on our body increases the amount of blood vessels and vasculature that our body has to have by more than 5 miles. And so it's really important to have a healthy diet overall. When you're inflamed, when you're not eating the right foods, when you're stress eating, it causes a lot of problems, not just on how you look, but also on your heart and cellular function as a whole. The number three risk factor is chronic poor spinal alignment. Your spine is so important to your overall health. Obviously, we talk about this a lot inside of our office, the importance of getting adjusted, not just to feel better, but to bring your spine into a healthy alignment and keep it in that healthy alignment. Newer research has shown that having poor posture is as big a risk factor for early onset mortality due to heart disease as smoking. So that's right. So people who have a bad posture over the age of 60, it increases your risk of death from heart disease by 1.44 times. It's equal to that of smoking cigarettes. When your spine's out of alignment, it also decreases immune function. You don't move as well. You can have pain, which increases your body's stress rates and your cortisol rates. There are so many things that are vitally important when it comes to having a healthy spine. The fourth one is toxins. So that's not just toxins in our food and air. That's a lot of personal hygiene products. Oftentimes we're exposed to chemicals like plastics and heavy metals, and those things accumulate in our body. They cause a breakdown of nutrient absorption. They can lead to toxic stress. They can lead to hardening and claudication of the arteries, and they definitely contribute to heart disease. And the last one, number five, is just the lifestyle choices we make on a daily basis. Whether we're choosing to drink excessively or smoke or not exercise, we can either lifestyle ourselves into heart disease or out of heart disease based on the decisions that we make in our daily lives. And so all the research that's been done on heart disease shows that while there's a very small genetic component to heart disease, the vast majority of people who are dying or having strokes or having heart attacks, that those are lifestyle-induced problems. So before we get too far into this, I want to explain to you exactly what heart disease is. Our heart is a muscle, and our heart pumps blood throughout our entire body on a daily basis, whether we think about it or not. Our entire arteriovascular system has to respond to stress. It has to elevate when we're running or when we're exercising or walking or moving. It also has to slow down whenever we're resting and digesting. Our body determines where our blood flow goes based on what we need. So if we just ate a big meal, we're going to send more blood flow to our digestive system. If we are sick, we're going to spend more of that blood flow going towards creating white blood cells to fight off infections. If we're running or exercising, more blood flow is going to go to our body's skeletal muscles. And so that entire system has to work properly. The way that our heart and arteriovascular system works is that we have these vessels around our body. They're big, hollow tubes that can expand and contract based on need. And so what research shows now is that the underlying cause of heart disease is atherosclerosis, or hardening of the arteries. Basically, over time, and there's several causes to this, our arteries lose their ability to expand and contract. Basically, they get small micro fractures inside of the arteries. Think like you're getting cuts on your skin if you don't take care of your skin well and you're getting wrinkles and lines and things like that. The same thing happens to your body's arteries. And so, whenever you no longer can expand and contract in that area, a couple things happen. Number one, we get an accumulation of cholesterol inside of our arteries. We're going to talk about cholesterol. Cholesterol is not the boogeyman like everyone thinks it is. Cholesterol is necessary, but it can accumulate in arteries over time. The second thing that happens is we get a hardening of our arteries. So due to nutrient deficiency, our arteries can no longer expand and contract. That's what leads to high blood pressure, and that's what can increase our risks of having a stroke or having a heart attack, because it forces, when we have to have high blood pressure, it forces our heart to lay down scar tissue and more muscle, and eventually that can cause the heart to fail. So to recap that, when inflammation occurs inside of the body, our body produces cholesterol to try to repair that. Cholesterol is our body's repair substance. And you don't have to take my word for it. Dr. Michael DeBakey is a famous cardiovascular surgeon. He performed more than 1,700 open heart surgeries and published research and showed that he found no correlation at all between the extent of coronary artery disease and the levels of cholesterol on a person's blood test. In fact, in 2018, the American Heart Association came out and said that total cholesterol has no bearing on cardiovascular disease. So why and how can cholesterol be bad? Cholesterol in and of itself is not bad. It is something called the oxidation of cholesterol that causes heart disease. So when we're looking at cholesterol overall in the body, the total amount of cholesterol that you have is not important. It's all the different parts of cholesterol that you have to look at to understand if you really have cholesterol as an issue or not. You know, years ago we talked about the fact that you had HDL cholesterol and LDL cholesterol, that HDL was the healthy cholesterol and that LDL was the lowly cholesterol. Well, in the past 5 years, several research studies have come out that have said that people with higher levels of LDL actually live longer than people with low levels of LDL. So again, that's supposed to be the bad cholesterol, but people with more of it are actually living longer. So it's completely backwards. Let's break that down just a little bit. When we look at cholesterol, we know that there are different types of what is called LDL cholesterol. We have different types of particles and sizes of particles. The only one that's been shown to be affiliated with cardiovascular disease is something called small dense lipoproteins, or SD-LDLs. The other types of LDLs that are larger and fluffier, they are not the types of LDL molecules that actually stick inside of our arteries. So if you're doing a cholesterol panel or you're looking at cholesterol in general, the general test typically will not tell you those things. You need to order what's called an advanced lipid panel or an advanced cholesterol panel to give you the actual sizes of your LDL molecules so that you really can get an understanding of what you need to look at and if you are in a disease state. The next warning sign of heart disease is something known as high blood pressure. Normally, our blood pressure should sit around 120 over 180. High blood pressure is anything that's over 140 over 90. So what is high blood pressure? Why do we get high blood pressure in the first place? Well, our heart has to pump blood through our arteries, and over time, nutrient deficiency, toxins, or adherence of cholesterol to the lining of our arteriovascular walls basically will take the openings of our cardiovascular system of the blood vessels, and it will make them harder, thicker, and less able to expand and contract due to our body's needs. So high blood pressure is basically the fact that your blood has to pump the same volume of blood through a smaller and smaller space. That's what leads to high blood pressure. Now, unfortunately, most people I talk to when they have high blood pressure, their doctors basically prescribe them, a blood pressure medication. They say, hey, try to eat right and exercise, and when that doesn't work, get on a blood pressure medication. Well, unfortunately, if you don't fix the underlying cause of the problem, blood pressure medications in and of themselves don't fix the issue. And so most research studies indicate that taking a blood pressure medication doesn't actually change your risk of having a heart attack. In some cases, it lowers your risk of having a stroke, but doesn't change the overall heart attack risk. So the solution here is we want to help you understand the things you need to be doing in your lifestyle to make sure that you're actually reducing your risk for heart disease, not just temporarily lowering your blood pressure. You know, a lot of adults, when they have high blood pressure, they're told by their doctor or they've heard or they've read on a website that you should be taking an aspirin daily. Well, research since 2014 has shown that that is not the case if you're over 60 and if you're using it for purposes of primary prevention, meaning you haven't had a heart attack yet. Research shows that you're more likely to have a gastrointestinal bleed than you are to actually prevent anything. So you're at more harm in taking an aspirin. The side effects outweigh the benefits. So there are a lot of things that you can do in your own life on a daily basis to prevent heart disease. And if you have high blood pressure or high cholesterol or oxidative stress in your body, there are a lot of things that you can be doing to work on reducing those. And that's by implementing what we call in our office the 5 essentials. So having a healthy mindset and applying the right knowledge to any problem like this for wellness. It's having a healthy spine and nervous system, doing the proper diet and nutrition, exercising well, and minimizing toxins in your body. So step 1 is having the right mindset. So the right mindset around this is focusing on fixing the underlying cause of the issue. Simply taking a statin medication or a blood pressure medication is only going to mask up the blood markers that are telling you you have disease and not the lifestyle factors that caused that problem in the first place. The second thing is you want to make sure that you're getting adjusted regularly, taking care of your spine and nervous system. The reason getting adjusted is so important is because it helps to balance your body's nervous system. Your body's nervous system has 2 halves, a sympathetic half and a parasympathetic half. The sympathetic half is also known as the fight or flight half. That's the side of your nervous system that actually is responsible for raising your body's blood pressure. Well, when we're under chronic stress, we have poor posture, we have pain, we have arthritis, we have nagging injuries, our body is going to live in that sympathetic or that fight or flight zone. With chiropractic care, we help to balance the 2 halves of your nervous system, meaning if you're in a sympathetic dominant state, if you're in a constant state of fight or flight, you're in constant pain, adjusting you helps to increase your body's parasympathetic tone, which has been shown to lower your blood pressure. It's also been shown to lower blood markers of inflammation, and it's also been shown to increase cardiac function. Cardiac function is measured by a lot of different means, but one of them is called heart rate variability. That's the ability of your heart to either beat at faster intervals or at slower intervals. And so we know that higher heart rate variability is correlated with a decreased risk for having long-term cardiovascular problems, meaning your heart's literally more adaptable to any situation. You can have a higher heart rate, you can have a lower heart rate, meaning you can exercise better and rest better. Over time, as we develop cardiovascular disease, the ability for our heart to beat faster or slower, that window gets smaller and smaller and smaller. And what happens is our heart is less adaptable to all different actions of life. So you want a high heart rate variability as much as possible. Research shows that chiropractic gives that to you, as well as helping your immune system work better, keeping you healthier aligned, keeping your posture better, all of those things. All right, the third essential for a healthy heart is having a healthy diet. You know, one of the most important factors that it comes down to when you're looking at cardiovascular disease and risk factors is something called your glycemic variability. What that really is that's the ability of your body to process glucose and get it out of your bloodstream. One of the biggest problems we have with the standard American diet is that most of us eat way more sugar than our body needs. Over time, as we eat more and more and more sugar or carbohydrates, those start to sit in our blood for longer as we become something called insulin resistant. And it's not just a few people who have this problem. More than 1/3 of Americans have some type of insulin resistance. When glucose spends a lot of time floating around in our bloodstream, it oxidizes cholesterol, which can increase the rate of hardening of our arteries, which is known as atherosclerosis. So by effectively eating less glucose or getting that out of our bloodstream, we can have an overall healthier diet and less inflammatory body. So if we're making dietary changes, step 1 is eating less sugar overall. We want to help reset our body's sensitivity to insulin, and we do this by cutting our intake of sugar. Now, your body only burns 2 things for fuel. It either burns glucose, which is carbohydrates, or it burns fat for fuel. So if you're going to eat less sugar, that means you have to eat more healthy fat. You know, fat's often gotten a bad rap. It's been vilified for clogging your arteries, making you fat, you know, giving you lots of problems in your body. But the reality is that fat, especially healthy fat, does none of those things. In fact, eating healthier fat helps create healthy cells, helps create healthy brain tissue, helps your body adequately burn fat, And again, having a fat-burning body is what you want for a good metabolism and for good cardiovascular health. So we want to eat a low-sugar diet. We want high amounts of good, clean, healthy fat. We want a clean-sourced protein diet, meaning we're getting grass-fed meats, organ meats, free-range poultry. We're getting grass-fed dairy products, wild-caught fish. We want to keep our protein as clean as possible because we're not just eating protein, we're eating what our protein ate. So if you're eating a cow that's been fed a diet entirely consisting of corn and grain, which is an inflammatory diet, well then now we're eating inflammatory meat and protein. So again, low sugar, high amounts of healthy fat, clean sources of protein. One last thought on fat here and describing what healthy fat is. Really, healthy fat is what I would call God-made fats. These are fats that grow in the ground that are readily available for human consumption. Unhealthy fats are not saturated fats. Unhealthy fats are fats that are made in a lab. So those are your trans fats, your partially hydrogenated oils, your canola oils, your vegetable oils. Those are largely synthetic or man-altered oils. And whenever we alter oils in a lab, trust us, they're not to make you healthier. The reason food companies alter oils is for one of three reasons. They either want them to taste better, they want them to last on the shelf for longer, or they want to make them so that they're cheaper to produce. None of which correlates with better overall health. So again, you want to get rid of the man-made fats. You want to stick with the fats that grow in the ground. So this is avocado oil, coconut oil, extra virgin olive oil, your grass-fed organ meats that have lots of healthy fat in them. Does fat cause your body to make more cholesterol? No, but fats do contain cholesterol in them, and by ingesting more fat, it may actually raise your cholesterol some. But you have to keep in mind that having a higher cholesterol is not necessarily a bad thing. If you do not have oxidative stress, having a little bit higher of a cholesterol, depending on where your levels are, does not necessarily correlate to poorer health. We take care of lots of people who come into our office who have blood pressure problems, who have imbalanced levels of cholesterol. They have high levels of the bad types of cholesterol, the truly bad types of cholesterol, the small density lipoproteins, the lipoprotein A's. Those are your bad overall cholesterols. As we work to get them healthier, we see all their inflammatory levels drop. Their blood pressure is better, they've lost weight, they feel better, they have less joint pain, they have less aches, they have less fatigue. Their overall labs are better, but their cholesterol may be 5 to 10 points higher because they're eating a healthier fat diet. That's not necessarily a bad thing. Research shows that people between 150 and 250 cholesterol have no difference in mortality rate. So it's not the overall number that matters. It's making sure you don't have the bad type of cholesterol and you don't have the oxidative stress inside of your body. So the next thing we'll talk about is the vitamins that you need to prevent cardiovascular disease, to lower blood pressure and to balance your cholesterol levels, to keep healthy arteries. Your body needs a multitude of things to be healthy overall. So these are what I boil down to the most important vitamins you need to make sure that you have in your daily nutrient makeup. The first one is vitamin B. For purposes of preventing heart disease, the reason that vitamin B is so important is because it helps break down a toxic compound that's produced by your liver as it's detoxifying you. That compound is called homocysteine. So without vitamin B, your body cannot break this byproduct down, and that causes a lot of oxidative stress inside of your cardiovascular system. In fact, research has shown that people who are deficient in vitamin B, just that alone can raise your blood pressure by as much as 4 points. The next vitamin that you need to be getting a lot of is vitamin C. Vitamin C is a precursor to collagen. Now, all women know what collagen is because it helps give your skin that beautiful elasticity. Collagen is important also for arteriovascular elasticity, meaning the ability of your blood vessels to expand and contract. So when you don't get enough vitamin C in your diet, you literally lose the ability for your arteries to get bigger and to get smaller. And over time, as they lose that elasticity and they get rigid, just like you get wrinkles or cracks on your skin, the same thing happens in your arteries, and that's when cholesterol can swoop in. So if you want to keep good, healthy arteries along with great, healthy skin, make sure you're getting vitamin C on a daily basis to help produce the collagen that you need. The next one's vitamin D. Vitamin D is obviously important for a whole host of functions, including immune health, including helping our body mobilize cholesterol around our body, including fighting off viruses, including keeping our bones strong. Without vitamin D, it's impossible to have a healthy body. So vitamin D goes in the vital nutrients for any category, because if you're not getting enough of it, your body's definitely not as healthy as it should be. The next one's magnesium. Magnesium is an element that helps relax muscle tissue. So every time your heart beats, it actually uses magnesium to relax itself. No different than after you spend time walking or working out in the gym, your muscles use magnesium to recover. If you're deficient in magnesium, you may have muscle cramps, you may be achy, you may be fatigued, you may be sore all over. Inside of your arteriovascular system, if you don't have enough magnesium, it can cause cramping of the heart. It can increase your risk for having a heart attack. It can again lead to the rigidity inside of your arteries. Research shows deficiency in magnesium can raise your blood pressure as much as 5 points alone and cause that oxidative stress. The next one is CoQ10 or ubiquinol. This is a cardiovascular antioxidant. Kind of interesting. We typically make this nutrient in good supply for the first 30 to 40 years of life. What we know now is that after the age of 40, we start making less ubiquinol. And there are a couple things that even further lower our body's ability to create this antioxidant. One is taking a statin medication. If you take a statin medication, it completely blocks the process by which your body makes ubiquinol, so that causes a lot of oxidative stress or damage to your heart. So taking ubiquinol or CoQ10, if you have cardiovascular disease, are taking a statin, or want to work on preventing cardiovascular disease, is really important. The last one that we'll talk about is what are called nitric oxide precursors. Nitric oxide is the ability of your blood vessels to expand and dilate. So the amino acids arginine and citrulline help facilitate that process. Inside a supplement we have called NOx support, there are tons of arginine and citrulline to help your blood vessels with vasodilation. It also contains creatine, which helps restore muscle recovery. So by combining the amino acids that help with vasodilation along with creatine that helps with muscle recovery, research has shown that that can help you give you a better overall healthy heart and better vasodilation, so you get better blood supply to your entire body. And the last thing we'll talk about is movement. You've got to be moving on a daily basis. So exercise isn't just going to the gym and lifting weights. You need a combination of lots of different types of exercise to keep a healthy heart. So the first type is low intensity exercise, and that's just really movement throughout the day. Your body should be moving around 12 hours a day. You get about 4 hours where you're allowed to sit down or be still, and then you can sleep about 8 hours a day. That's the average for what we need. Most people are sitting 12 plus hours a day and only moving 4. So one of the biggest deficiencies that we have in our life, along with nutrient deficiencies, not getting enough healthy food, is a lack of movement. So move daily. That's walking, that's low intensity exercise. You want to couple that then with some weightlifting exercises. You want to work on building muscle. That's going to keep your body stronger. You also want to do high intensity interval training. So that's short durations of really high intensity exercise like sprinting or boxing or air squats as fast as possible. Those high intensity burst training interval sessions really help hormonally, and they also help increase your body's heart rate variability, because when you're on a high intensity exercise, your heart rate's going to get really high and then it's going to drop down. You're going to be training your heart from a cardiovascular perspective by doing each of those different types of exercise. I hope you guys have enjoyed this recap. If you guys have more questions, please let us know. You guys can always schedule what's called a 5 Essentials consultation in our office. We also have note packets. So if you want to refresh yourself on anything that I talked about here, these are available. If you go to the front desk or you send us an email, we'll make sure to get these to you. We want to see you guys be healthy overall. And I'm tired of seeing patients come into our office who just don't have the right answers when it comes to their health. Not because they're bad people, because they were never taught this stuff. So I encourage you guys to apply these in your life, and please pass this information on. If you have friends, family who need this video is going to be up on YouTube, on our social media. Make sure you share it around and help our community become healthier and live better lives. Thanks.